but it actually gives you an opportunity to become healthy. And I think that that's about as good a combination as you're going to get. Because I think everybody in this audience has to be aware of health issues and understands how important wealth and health really are. So with that, I want to start by saying that I have some incredibly exciting news in medicine for all of you. I mean, really, really exciting. But you're going to have to stay alive in order to benefit from what I have to say. So the goal is staying alive. Of course, living well would be a nice, addition to staying alive. But the reason I'm saying this is so exciting is that I can tell you without question, I'm a full professor at NYU, we teach medical students, we have a large center for men's health in which 30% of the practice are women, which we're obviously very, very proud of. Healthcare is going to dramatically change. Very effectively, diseases that currently are really scaring everybody to death. We're talking about Alzheimer's, we're talking about diabetes, we're talking about heart disease, we're talking about pancreatic cancer. Okay, we're talking about the killers, not only of people's lives, but of their vitality. But in order to benefit from this new technology, that some of it will be spurred by AI, some of it not, you're going to have to stay alive to benefit. So you're going to have to invest in the next 5 years. This is not 30 years from now. This is 5 years from now. If you can stay healthy today, you're going to be the beneficiaries of this really great new technology. And I think that that's really going to be my main message, which is stay alive, okay? Now, another big issue is wellness, right? And everybody wants to be well. It's just very difficult to define what is wellness. I can define what is illness. And the medical profession, I'd say 99% of us are focused on illness, and unfortunately not enough on wellness. We know how to measure illness, right? Blood pressure, cholesterol, blood sugar, an abdominal chest x-ray. But how do we measure wellness? That is going to be another challenge over the next few years. But what is clear is that wellness is not the absence of illness. So just because you feel well, that doesn't mean you are well. This is very important, especially for the men in this audience who have a tendency, not necessarily in this audience because you are all aware of how important health and wellness really is, but for the people that you're going to be talking with in trying to promote wellness. Men somehow think that if it's, well, guess what? Men live 5 years less than women. That's called the longevity gap. Okay, by the way, that's across all mammals, so maybe there's nothing that men can really do about that. But they can at least try not to die of diseases that they need not die from, such as heart disease and many other conditions. So you have to be able to understand wellness is not the absence of illness. When we ultimately try to define wellness, it's going to be a lot easier. The reason that people get confused is that you don't appreciate the aging process. You don't appreciate the decline in function until something becomes obvious. So for example, for most of us, the first sign that things are maybe changing would be you need glasses, right? So at age 42, 44, all of a sudden now you need glasses, you need reading glasses. Well, guess what? Every organ in your body is undergoing similar changes, and those organs need glasses as well. But because we have so much reserve capacity, you don't appreciate that your heart muscle is not as strong as it was when you were 20. You can ask a professional athlete, and they will tell you they know for certain because for them, being able to hit a baseball at 99 miles an hour at age 40 is a lot more difficult. No matter how great you train and however well you eat, you're going to not be able to do certain things as you get older. But fortunately, you won't appreciate that you've lost a little bit of heart function or liver function or lung function, but every organ in the body is undergoing a change, unfortunately a bit of a decline. So the challenge in wellness is how do we slow that process down so that you can function at the highest level at every age. And when we're able to understand the parameters, the factors that promote wellness, we will be able to make some really important changes. This is saying the same thing. The absence of illness is not wellness. You're in the wellness business. You're not in the illness business. But can I encourage all of you, if you have not, to go to the doctor and get your blood pressure checked, get your cholesterol checked, get your blood sugar checked, okay? And if you need a mammogram or you need a colonoscopy, those things are critically important, all right? Because we know basically, unfortunately, that because of the environment, bad things are happening at a younger age. Why are non-smoking women getting lung cancer? Why are young patients getting colon cancer before the age of 50? This is really very disruptive. We're certain it's something in the environment, is something that is promoting this issue. Now, there are evil forces in the body, is the way I think about it. And the evil forces are terms that you have heard that are really difficult to really understand from a physical, biologic point of view, but you'll hear about oxidation. Oxidation is something that is the part of human biology and human biochemistry, but too much in oxidation causes injury to all the cells in your bodies. Okay? And that's why, quote, antioxidants may have some value, because it's one of the evil forces. The other evil force is inflammation. When you go to medical school, you're a doctor when you first take pathology and you understand what inflammation really is. Inflammation is a process in which the body is responding and reacting to a foreign substance. So if you have a splinter in your finger, in a day or so, that's going to get red. That's called inflammation, okay? But that's good inflammation because that inflammation is intended to eject that splinter. But too much inflammation will destroy the tissue in your hand. So you have inflammation as a result of dealing with infections or immune issues, but when that inflammatory reaction goes overboard, you get rheumatoid arthritis. You get pericarditis, which is an inflammation of your heart. So oxidation, inflammation, radiation, pollutants, cigarettes, excessive alcohol, those are the evil forces that are contributing to illness and the absence of wellness. So you need to focus on those factors and see whether or not you can reduce them in your life so that you have a chance of living well. Now, when I speak to patients, I always ask them, so what are you going to do to improve your health? All right? And invariably, they'll say to me, well, I'll exercise more often. Exercise alone is not going to get you to the promised land, okay? The body is too complicated to think that any single intervention is going to make all the difference. You have to do it all. You don't have to do it obsessively, you don't have to do it in a crazy way, but you have to understand that wellness is about sleep, stress, exercise, and nutrition. Sleep is as important as food and water. If you ignore sleep, you're not going to be well, because somehow sleep will cause inflammatory reactions, will cause excessive oxidation. There's a common pathway. If you don't eat well, you won't have the nutrients to have enough antioxidants on board. You won't have enough calories on board. Exercise, we all already know how important exercise is, but it has to be part of sleep, stress, exercise, and nutrition. Stress management, that is obviously post-COVID, in this very chaotic world, a really serious issue, and something that, I'm not certain that we're doing a great job in managing stress in our lives. I do think that things like biofeedback and meditation are really quite helpful. But it's got to be, all of you have to incorporate these sleep, stress, exercise, and nutrition. That's the secret. And when you look at this, eat well, sleep well, exercise, and of course, what the next one's going to be. It's going to be the proper nutrients. So when we talk about nutrients, hopefully you could get all your nutrients in your food, right? That would be the best if you could. But guess what? You can't. The food groups are, they're very low density calorie. They're not low density calorie, they're low density in nutrients. And so you have to take a lot of calories in order to get the nutrients that hopefully can function as anti-inflammatory and antioxidants. But even the best of us just don't and can't manage, to get an adequate amount of optimal nutrients in our diet. I wish that were the case. It just isn't. So where does pycnogenol come in? Well, number one, before I say something about pycnogenol, you have to understand that you just can't make things up, okay? You can't, this is something that requires research, data. Well, I actually came across my friends in pycnogenol many, many years ago when I was writing a book about anti-aging, and my co-author and co-writer said to me, "What did you hear about this antioxidant called pycnogenol?" I said, "I really don't know that much about it." But it turns out that there are hundreds and hundreds of studies, hundreds of papers that, validate what these people are saying. Pycnogenol doesn't cure cancer. It doesn't prevent you from having a heart attack. It doesn't necessarily prevent you from having a blood pressure medicine. But what it will do is it will support the body's efforts to maintain wellness. And if you would like to take less medicine as you get older, maybe you need to increase your level of wellness. And that's what my friends at pycnogenol have found. Look, they studied thousands and thousands of people, multiple clinical studies. They've invested, I don't know how much money, millions of dollars in research over the last 30 years or so. So, you need some evidence. It's got to be, you just can't make things up. Okay, you happen to have the best form of pycnogenol that I've heard of, because it's so bioavailable, it's easy to take, and it's your foundational antioxidant, and does more than just antioxidants. It does everything to prevent your blood vessels from getting injured. It helps lower cholesterol, helps modulate your blood sugar. It does a lot of really cool things, and the more things that they study, the more positive studies they find. And why is that the case? Because each organ in the body is going to react to these evil forces in one way or another. If this reduces the level of those factors, of course it's going to have a positive impact. If you know that cognitive function is a function of inflammation in your brain, and now the discovery of what we call these amyloid fibrils, then of course a product that helps reduce inflammation is going to have a positive impact. Is this going to cure somebody of Alzheimer's disease? Of course not. By the way, in the next 5 years, we're already starting. We have these new medications that to stop the amyloid fibrils from aggregating and which are causing dementia, and that is really exciting, because the worst thing you could do is to have somebody 80 plus and really in a demented state. That would be very tragic. But these new treatments are going to be very exciting. So what did pycnogenol do? They studied women's health. They studied heart and circulation. They studied exercise. They studied cognitive function. And you ask yourself,